Welcome to Hidden Voices, the podcast series which explores the less heard voices in health and social care. I'm Sam and I work for Healthwatch Essex. It's our job to make sure that people's experiences help to inform health and social care services. In this episode, we're talking to Nick Hulme, CEO of East Suffolk and North Essex NHS Foundation Trust, about his experiences and the future of health. Hello, Nick.
Hello, how are you?
I'm very well, thank you. How are you?
Yeah, good.
How are you feeling at this point?
Really mixed. I've had 46 years in health and social care, most of it in the NHS, and that ends in about 10 days' time. So there's so much I'll miss. There's so much I won't miss. So I'm feeling very mixed. But so I'm anxious, I'm relieved, I'm terrified, I'm elated, and sad. All of those emotions.
How did you end up in this role, Nick?
As a chief executive. So I've been a chief exec for 15 years. I was at Croydon for a couple of years, and I've been up here for 13 years. And I've basically worked right across health and social care. So I joined the NHS on the 8th of January 1980. And I remember that day because I was working in Selfridges, selling dolls' houses up until Christmas. And then they moved me from dolls' houses to menswear for the sales. And it was a really important lesson because terms and conditions were the same, the hours were the same, but the team was completely different. And I hated it. And so one lunchtime I walked into the Middlesex Hospital and said, have you got any jobs? And they gave me a clipboard and I filled in a bit of paper. And they looked at it and they said, can you start on Monday as a porter at A&E? And no checks, no nothing. No references, and I said, yeah, of course. And so I did, and that's where I started, and I've worked in mental health, I've worked as a healthcare assistant. I spent 10 years working in HIV and sexual health at the beginning of the HIV and AIDS pandemic in the mid-80s. And then from there I went into various management roles, general manager, director of operations, deputy chief exec, and then finally chief exec. So it's been a very mixed career of work. I spent a couple of years working with homeless men in the middle of all of that. So it's been a very mixed career of working directly with patients and clients for about 15 years. And then the rest of it has been in leadership and management roles.
There's a hell of a career and a lot of different, potentially quite challenging cohorts and jobs. What's been the most challenging part of your career or part of your role?
Gosh, that's a really good question. They've been different. I mean, if I go back to the days of working in HIV and AIDS in those early days, that was challenging in some ways because we didn't know much about HIV and AIDS. We had no treatments at the time. It was all about, sadly, talking to mainly young men about the end of their life and a really difficult time. As well as all the kind of fear and stigma. And it was the first time I'd experienced the kind of inequalities of healthcare. Not that there were financial inequalities. I mean, HIV in those days was so well funded. We had money to burn, literally, but the inequality in terms of the stigma and the fact that gay men, intravenous drug users, African women mainly, who just couldn't get access to health and social care, partly because of stigma, but partly just because the services were not designed. So that was a really difficult time. And then as my career has progressed, now in leadership roles, some of the real challenges that we face around really playing. I often say it's about spinning plates in my job. How do we satisfy patient and public needs and demands, that's staff needs and demands which might be slightly different, financial responsibilities, the political with a small p and a capital P responsibilities that we have, and there is no way you can keep everybody happy. Somebody will be upset, and I am accountable for that. I am very well rewarded to do the job that I do, and I love the job that I do, but it does come with responsibilities, and therefore it comes with a high level of accountability and therefore stress to try and balance all those different needs. But it's I choose to do it, so I must love it.
Going back to the HIV work, and we were losing hundreds and thousands of people at that point in time,
Yeah.
and you were right there in the centre of it. How do you protect your kind of own mental and emotional well-being during that?
That was a really good question. So I think the first thing was that I worked with an amazing team, and we were all in the same place. So we were all dealing with issues of death and dying and bereavement and illness and disability. And the only people who supported me were the people who I worked with, particularly working HIV, because there were friends of mine and family members of mine. I didn't tell them what I did for a living because I knew that they would be judgmental. So I relied heavily on the team. But there did come a point at which, and that's why I left the direct work, that I came to the point at which that I became desensitised. And it was one particular patient I remember. I just couldn't get through to him. And he was one of those patients you'd see in your diary. I'm being completely honest now, and my heart would kind of sink. I think, oh gosh, I just, he just used to come in and I just couldn't find a way of supporting him. And then one week he cancelled, and he just didn't turn up. So he just didn't turn up, and I was so relieved he didn't turn up. I thought, oh, thank goodness. And then I found out subsequently the reason he didn't turn up is that he'd actually died by suicide. And I thought, if I can't, because I'd lost that sense of empathy, I thought I've got to go and do something else. I think a lot of people go and do something else and then come back, but that wasn't for me. I was, I think burnt out is a massively overused term, but I did feel that I couldn't give any more at that time. So that's why I decided to go into a leadership role. But it taught me a really, really important lesson that there is a finite amount of capacity that you have to care, and we shouldn't always, and I'm speaking to myself here as any of your listeners, we shouldn't be too judgmental if people lose that ability to care. Maybe we need to be giving people a break. Maybe we need to think about sabbaticals. But I was also given a great bit of advice many years ago by a cardiologist who said there is no way that a clinician can care for all his or her patients, because you don't have the emotional capacity to do that. But you need to be bothered.
Yeah.
And it's a much lower bar, but just be bothered. Just be bothered about what happens to people. Some people, and I can think of patients and clients when I worked with the homeless, when I worked in mental health, when I worked in HIV, they really stick with me. To this day, I can remember them, remember their families, remember their names. And for some reason, I really connected with them on a very, very kind of emotional level. For the other hundreds, maybe thousands of people, they didn't touch me in that way. But I hope that I was bothered enough to care about what happened to them. So I think it's a fine line. But I think it is incumbent upon us as leaders to remember that sometimes it just gets a bit too much. And we shouldn't be too judgmental, and maybe try and understand a little bit why, from the face of it, it appears that people have run out of their capacity to care.
I think that's a really valuable lesson for lots of us to consider. So moving away from sort of that direct clinical work into the leadership roles that you've been in, how do you manage what must be a very expansive role with lots of inequalities and lots of challenge? How do you ensure that you are inspired by the tricky things you see and not overwhelmed by it?
That's a really, really good question, because sometimes it does feel completely overwhelming, particularly when the same issues come up time and time and time again. And there's a kind of inability for us as an organisation, for us as a service, for us as a society to deal with them. So I think for me, it is about small and marginal gains. So if you look at the massive inequalities that we deal with just here in Esneft, we work with some of the healthiest and wealthiest people in the country, and we work with communities that are some of the most, facing real poverty, unseen anywhere else in Europe. And so, I kind of don't worry too much about people with health and wealth. Of course they're important, but they also have the ability, and they have the power, political power, financial power, to kind of fend for themselves. when we look at the huge numbers in our society, in our communities, who really are vulnerable, mainly because of poverty, and poverty isn't a word we use very often. It's a word I use a lot because it's the reality. Making a small marginal change for those people and for their families is much more important to me than making buildings or anything else. So I think for me, and the other thing to remember is, of course, it's not just me. I work with an extraordinary team of people, my immediate colleagues, the executive team, and then the wider hospital and the wider health and social care team as well. One of the things I think is really special about working in this part of the east of England is that there is a strong sense of system. There is a strong sense of partnership with the local authority, with the third sector, even with HealthWatch, dare I say. I have to say, because I'm on their podcast. Indeed. But no, genuinely, I think that is, it's not unique, but it is quite special. I think that particularly in Essex, there is a real sense in Essex of having each other's back. Yeah. It's embedded in the culture, and I think we probably don't build on that kind of community spirit as much as we could. So, but in terms of being overwhelmed, it can feel overwhelming. It can feel overwhelming just in terms of demand. So here we are, middle of winter, middle of a junior doctors or resident doctors strike, middle of a flu surge, and coming in every morning and seeing patients sadly being cared for in corridors, looking at our staffing numbers, because of course flu affects staff as well. I'm just thinking, how are we going to get through today? But we do. We do. Every day we come in and it's the same again. So the resilience of our staff and the resilience of the system to cope with those sorts of demands, it's just truly extraordinary. And I get asked a lot, by the media and by others, will you cope? I said, well, yes, we will, because we always do. That's down to individuals, that's down to teamwork. So it is about also knowing that if not us, then who? The NHS is the most precious thing about living in this country. It's unique, it's special, it should be protected at all costs, and it's incumbent upon us to make that work.
How do you think you build resilience as an individual and as a team?
I think we've got to be, I know I've just used the word, we've got to be careful about the word resilience, because if resilience means to some people, we'll throw everything at you and you just cope, then I think that's ignoring both individual strength and collective strength of teams. So I think for me it's about the most important issue around survival, improvement, resilience, if you like, is about optimism. Yeah, I think leadership for me is about creating hope and optimism. Here at ESNEFT, our first value is to be optimistic. And it's not blind optimism. It's not saying, it'll be fine, don't worry, it'll be fine. But it is about saying, we will get through this. And for me, it's always about reminding people the difference we make. So I say to, as many times as I can in a day, we're a team that improves 10,000 lives every day. So ESNEFT touches 10,000 lives every single day.
It's a huge number, isn't it?
And when you get home at the end of the day and somebody says, what did you do at work today? And you can say, I was part of a team that improved 10,000 lives. I'll take that. So I think for me it's about always reminding people, no matter how dark it appears, no matter how challenging it appears in the here and now, we are making a difference. We are building optimism. We are building hope and aspiration. And for me, that's what's so special about the NHS, is that you never, ever, ever have to worry about what it's going to cost you. You're never going to have to worry about whether or not you've got the right insurance premiums paid up. You're never going to have to worry about whether or not your insurance covers your children or covers long-term conditions or covers frail elderly. All you need to worry about is getting better. All you need to worry about is being cared for. And that is so, so special. I think it's vulnerable. I think it's under threat at the moment. But we've got to hold on to it.
Great, thank you. Changing tack slightly, you've worked in hospitals, and this particular hospital, for many, many years. What do you think other people, so our listeners, the public, would be most surprised about what working in a hospital is like?
Gosh, that's a good question. So I think, and I've been thinking about this quite a lot. We don't save as many lives as people think. Now, that doesn't mean that we could save lives and we don't. Let's be absolutely clear for your listeners. But so the idea that hospitals are a little bit like Holby City or Casualty, where every day it's a drama and we're saving lives of course that happens, and the people that do that are sublimely talented and kind and courageous. Hospitals for me are about giving life back. So we hear stories of if you become ill, your life's put on hold. Even if you're not ill, if you're worried about something, if you find a lump where you shouldn't have a lump, or if you have something that makes you feel unwell and you're really, really worried, until you're given assurance about either that's nothing, carry on with your life, or actually that is something, but we've got you, we're going to treat you. That period of waiting is having your life put on hold. If you are a grandparent and you can't pick up your grandchildren because you're waiting for a shoulder operation, or you're you love walking and walking is really important to your mental health, or walking your dog and you can't do that because you're waiting for a knee operation, your life's on hold. So illness puts lives on hold. It also causes stress. Being ill causes stress. So for me, hospitals are about giving your life back. It's about getting that diagnosis as quickly as possible so that you can either be assured that you're going to be treated, or you can be assured there's nothing to treat. It is about, if you come in with an infection through A&E, treating you quickly, getting you home as quickly as possible, and it's safe to do so you can get on with your life. So I always say, hospitals in a very small number of cases are about saving lives, but in a very, very large number of cases, it's about giving lives back. I think the other thing about hospitals is they are incredibly complicated. Now, probably too complicated, to be fair, but we are, whether we like to describe ourselves as not, we are a business. I am responsible for £1.3 billion worth of taxpayers' money, and I take that really seriously.
Yes,
but I'm also responsible for 12,000 staff, and I take that seriously as well. So half of the people that work in a hospital are non-clinical. We're managing a very complicated, probably overcomplicated system, and anybody that's tried to work their way through the real complications, not just of hospital care, but then community care and social care. I've been in the health service, all my working life. When my wife was sick, even I got confused about who should I call here and what should I do with this. I think, well, if I'm finding it difficult and I run these blooming services, then what about everybody else? And that was an important lesson for me as well.
Thank you. Thinking about your kind of career and professionally, what's been your proudest moment?
I think my proudest achievement is actually some years ago, probably 25 years ago now. So there was a very, very famous case, and I can't remember who it was, but it was quite a famous case of somebody who was accused of sexual assault and rape. The case went to trial, and the trial collapsed because of a lack of forensic evidence. And the reason that happened was because in those days, if a man or a woman was sexually assaulted, they used to go to a special, often in a kind of, as a room in a police station somewhere that used to be opened up in the middle of the night, and people would go along and have their swabs taken, and all the forensic evidence collected by somebody who wasn't necessarily a full-time person, often a GP or somebody who'd been trained additionally, no additional support given, and then just basically let go. And so a lot of men and women, mainly women, who were sexually assaulted didn't want to go through that process, understandably. And for some bizarre situation, my brother was the detective on that case, and I was having dinner with him and his now wife, who was also a very senior police officer who ran some of the rape services in London. And we were talking about it, and they said if only we had a 24/7 service where people could come along, have all the forensic work done, but also get counselling and have all their sexual STI testing done and everything else. And so from that conversation, a bizarre set of circumstances, I happened to be working with a junior doctor, resident doctor, who was the daughter of a previous Secretary of State for Health, and a whole load of things happened. And so we put together a small team with the Metropolitan Police, myself, I led the team, and we created something called the Haven. So there are now several of these across the country. But this was a 24/7, 7 days a week, that if we got a call, a qualified sexual health doctor who was forensically trained, qualified nurses who are forensically trained, and counsellors would come to the unit and provide excellent, both the forensic collection of forensic evidence and the support and the treatment and the ongoing counselling. And so when I look back on my career, that's probably the thing I'm most proud of. Now, it wasn't just me, it was kind of one of those situations where the planets just lined up. Influence of my now sister-in-law and my brother and this wonderful resident doctor whose mum was the Secretary of State for Health years ago and everything else. And sometimes things just happen like that, and then we were able to get the funding and everything else. So I'm really proud that we're able to do that, and that it's been copied and everything else across the country, because that really matters. A lot of the stuff that I do doesn't really matter. I mean, it matters in my head, but it doesn't really matter. That really made a difference, I think. So I'm really proud that we were able to do that, and I think that's probably the thing I'm most proud of. Although it's, gosh, when was it? That was the late 90s. Gosh, I'm old, aren't I? That's frightening.
I think there's two things to take away from that, and one is that that's an incredible service that's going to impact so many people's lives, but two is that you were open to see an opportunity and then able to make it happen. Because you were optimistic about being able to make a change.
I think so. And it's also, it taught me a very early lesson in terms of how to appropriately involve politicians. So just being able to kind of influence at a senior level some of those politicians quite informally, and and to sell an ambition, and but also not to compromise, because it was like, well, we could probably afford a 9 to 5 service. And I was saying, no, it's got to be 24/7. If you look at when sexual assaults happen, they don't happen 9 to 5 Monday to Friday. No. They happen all the time. And then it was, well, could we compromise on the counselling? No. And if you've got the ambition, don't compromise. Be ambitious, and it happened. And that was something that was as you say, it was be optimistic, be ambitious, set a very, very high bar, and don't shrink away from it.
I think very valuable lessons to take away. You're galloping very fast towards the end. It's in touching distance, the end of this long and illustrious career. What will you miss the most?
I think it sounds almost trite to say, Sam, but I'm going to miss the people. I work with incredible individuals. Not all of them. There are some people I will not miss, and no, I'm not going to give you a list.
Just the names will be
just
fine.
Just the names. In the main, the people I work with are inspiring, and it's not just the incredibly sublime, talented clinicians that I work with. It's the vast majority of people who are here to do a good job, and it is a very, very social. It takes. Somebody said to me, "What's the biggest difference as you become more experienced as a chief executive?" I just say it takes you longer to walk down the corridor, because there are so many people to chat to. And one of my sadnesses about now, leading a very large organisation, is that I've lost a bit of that. When I was just Ipswich Hospital, even before we took on community services in Suffolk, in East Suffolk, I kind of knew everybody. I knew all the resident doctors, I knew all the consultants and everything else, and I missed that a little bit. But I just, there's lots more people to get to know, and so I'll miss that. I'll miss that. Albeit relatively rare occasions where I feel I'm making a difference. It's not a job where every day you think, oh, I've done that. And although I say work as part of a team that improves 10,000 lives every day, it doesn't feel like that every day. Sometimes you just leave, I get home and go, what was the point in that day, or that week, or even that month? So I won't miss that frustration, but I'll miss those moments where I just think, actually, I did make a difference today. That's often the difference that can be really, really small. There was a woman who was really upset. Just in the coffee queue, I was getting a coffee the other week, and I just sort of said, "Are you okay?" And it was something relatively small. It was about she hadn't been, she had an appointment cancelled, hadn't been given a new appointment, and I just said, "I'll fix that for you." And she said, "Oh no, I need to talk to." She said, "I need to talk to somebody that can fix this." I said, "I can fix it." She said, "Can you?" I said, "Yeah." And then she saw my badge. She said, "Oh yeah, you can." So that was really nice, and it was a relatively small thing, but it made a difference to her.
Yeah.
And the idea that these amazing jobs that we do, which are both fantastic and awful, sometimes in the same morning, the idea that we're doing big things all the time and building buildings and changing systems and redesigning pathways, it's not that really makes the difference. It's the small things that we do that really makes the difference. So I shall miss that.
Yeah, thank you. You mentioned earlier about your relationship with the Health Watches, and I know as a trust you've done a lot with patient voice, and with all the changes that are happening at a governmental level and in funding and so on and so forth. How do you think that's going to impact on patients being heard in the system?
It really worries me. It really worries me. I think hearing the patient voice, it's difficult. It's difficult because if we just listen to the people who shout the loudest, then we're going to get it wrong. Because to my point earlier, is that the people who shout the loudest often have the least need. Because they've got a voice, because they have the ability to write me incredibly clever letters, or they know how to contact me, or they have access to social media, whatever it might be. If we only hear those voices, then the voices of the most vulnerable will not be heard. So I think organisations like Health Watch really give voice to the unheard voices. I think that the demise of Health Watch, and I remember the community health councils and all of the various sort of iterations of patient voice and patient, public, family voices. So it's not just the patients. And I've been through all of them, and I was surprised to see the demise of Health Watch and disappointed. It's not, Sam, you and I both know this, it's not always an easy relationship, but it's always been a respectful relationship. The two Health Watches that we work with, yourselves and colleagues in Suffolk, and I hope we've always been responsive. What worries me is that we are then going to be in a position where we are left responding to the people with the loudest voices, and the loudest voices are not the ones we need to listen to. So I think there's more to do. I think that whatever the iteration of Health Watch becomes, I think the other opportunity we have that, I'll be honest, we haven't used terribly well is our kind of membership, our governors, and how could Health Watch and our governors and our members come together to give us a voice. But we also need to listen. I can remember my first couple of weeks here, I was at a meeting in near Clacton, and a very, very forthright person said to me, "Here you are again, another one, asking us what we need. We'll tell you. You're going to do bugger all about it. So what's the point in talking to you?" And I've never forgotten that, because I think, look, we're not going to address everything. We can't meet all the needs of everybody. But if we are genuinely going to listen, then we genuinely either need to say, "I've heard you, and this is why we can't deliver whatever else you need," or "I've heard you, and this is how we can help you." So it does worry me, and don't get me wrong. There are times when I open up my inboxes, I think, "Oh God, really?" And it's interesting. I was thinking about this over the weekend. It is obvious now that some of the messages, some of the emails that I'm getting, some of the complaints that we're getting are AI generated.
Yes.
People have put a few comments into ChatGPT or wherever it might be, and we've got a fairly formulaic, very well written by a computer complaint, and it is obvious there's a certain way, and I could just put it into my co-pilot and send a response. And a few staff were kind of having a bit of a moan about, AI writing complaints. I have a slightly different view, because what AI might do is give a voice to people who are not literate, who don't have the skills or the ability to construct a really well argued or well balanced complaint letter. But AI allows them to do that. So we shouldn't throw that out. We shouldn't ignore that just because they're using a slightly different method in order to inform us of their concerns. So I think, how can we use the public, how can we use organisations like yourself and whatever Healthwatch becomes, how can we use our members, how can we use the patient feedback? And we're only going to improve by listening to our most upset patient. I mean, it's lovely to get a compliment letter, but as I often say, we're just doing our job. Like if I get on there, I go to London quite a bit for work. If I get on the train at Colchester or Ipswich, it arrives on time, I get to Liverpool Street on time, the Wi-Fi works and I get a seat. I don't tap on the driver's window and say, mate, that was amazing. That was fantastic. And I think sometimes people's expectation of the NHS is so low. I get letters saying, gosh, my GP referred me, I got an appointment, I was seen on time, the people were kind, and I got a result. That's amazing. No, that's our job.
Yeah.
And it's nice to get those letters, of course it is. But I think we just need to be a bit more honest with ourselves about what the expectation is. The NHS is amazing. It is incredible. It is the best health system in the world. It's not delivering the best health service in the world. And I think that's the challenge for us going forward. I don't necessarily agree with the current Prime Minister that we need to reform or die. I don't think reform is the answer, but improvement is. And we've been given more money than we've ever had. We've got, certainly in our organisation, new buildings that we never had. Our staffing numbers are higher than they've ever been. Now, one could argue that they're still not quite high enough in some areas, and yet our productivity is still not where it needs to be. Our quality is not where it needs to be. So it's incumbent upon us to fix that.
Just jumping on that or building on that, what do you think the biggest opportunity is in health now?
Technology. Because technology has transformed every industry. Every single industry. I cannot remember the last time I was in a bank. And when I started my NHS career, in order to get cash for the week, there weren't many cash points in North London. I grew up in Leicester. My bank was still in Leicester. And the bank in Leicester had an agreement with the bank in Muswell Hill. I was working in a small hospital, living in a small hospital near Muswell Hill. And on a Friday lunchtime, I had to rush up to the bank, show them a cheque and some ID. They'd give me whatever money I had in the bank for the weekend, and then I'd go back to work. Now that's unheard of now. And if I didn't get a lunch break, this gets weirder, I had to go out on a Saturday morning, buy a pair of trousers in Marks and Spencer's using my chequebook, and then take them back to a different Marks and Spencer's in the afternoon to get cash when I handed them in as a refund to fund my weekend. Now, that was my world when I was 18, 19. Unheard of now. So every single industry, I can remember, you probably can't, but I can remember booking a holiday with, a whole pile of magazines and working through them and going into a travel agent, all that wasted time. So every single aspect of our, whether it's Amazon, whether it's banking, whether it's booking holidays or trains, whatever it is. And yet the NHS, we've got 21st century healthcare delivered in 1960s processes. The philosophy of ESNEF is time matters. And the amount of time that we waste because of our inability or our refusal to invest in technology. But also, we need to have some courageous conversations with our staff, because the reality, the stark reality is that if we introduce technology and AI and automated systems, we will not need hundreds of the staff that we currently employ. That is the reality, because if we continue to employ them and they're not fully occupied, then we are wasting money that needs to go to patient care. This is really, really difficult stuff.
Yeah.
But we have to have that conversation. Because so the other aspect of technology is actually in delivering healthcare. I cannot see that in 5 years' time, whoever has the privilege of replacing me in this organisation will be employing people to sit in a dark room looking at TV screens to look at X-rays and MRI scans and CT scans, because there is already technology being used right across the world that does that better than human beings. It does it better, it does it quicker, it does it faster, and it does it 24/7, 7 days a week, 365 days a year. More than we could possibly imagine. And that is where healthcare is going. If you go anywhere else in the world where there is competition in healthcare, all of those systems are being used. The reason they're not being used widely in the NHS is because there isn't the burning platform of competition. Now, I'm not suggesting for one moment that we create competition, but unless we are honest with ourselves, honest with the public, honest with our staff about the need to improve, then I think the NHS is really vulnerable.
Yeah.
Because, I know you know better than I, because you have more contact with the public than I do. People are running out of patience. People are running out of, the NHS is so revered that we always make excuses. Well, we know how busy. Oh, those staff run off their feet. Oh, COVID was 5 years ago. All of these excuses that we use, the public believe, and eventually they will run out. People will say, hang on a minute. You've got Europe's largest orthopaedic centre in Colchester, and yet I'm still waiting a year to have my hip replaced. Why? If you look at the budget, the NHS got more money than any other public sector. People are going to be saying, where's that going? And what that does is, for the first time in the history of the NHS, I think people are genuinely questioning whether or not it's fit for purpose as a system going forward. And we know that there are very, very loud political voices who want to see the NHS, see the end of the NHS. So the opportunity around using technology to improve, both for the non-clinical aspects of care, but also the clinical aspects of care, if we ignore it, if we bury our head in the sands, then I think we're really vulnerable.
Thank you. As Healthwatch Essex rebrand and pivot into a new direction, what's the one thing you hope we don't change or don't lose?
Your courage. It's a tricky, it can be. And, I'm thinking about years ago with the CHCs and others. If we become adversarial and we get defensive in the health service, then it's too easy for you just to become very, very, very annoying. And the more annoying you become, the less I'm going to listen. At the moment, I think there's a really strong and respectful relationship between yourselves and other patient groups. But it also means that you're not afraid to be courageous. You're not afraid to have those courageous conversations with us about what you're hearing. So I think that's the one thing. But also your ability to go into those dark corners. Where are those voices that we are just not hearing? Whether that's because of demographics, whether that's because of underrepresented in our society for whatever reason, then don't lose that. And it's going to be really difficult because you're going to have to be funded by somebody, unless you're all going to become amazing volunteers, which I think is unlikely because you've probably all got lives to pay for. But the minute you are funded by somebody, the danger is that you become beholden to them and to their agenda, and it almost doesn't matter who's funding you. Throughout my incredible and rather strange career, I worked for the Terence Higgins Trust as a non-executive director, and I chaired the Terence Higgins Trust for 3 years, which was one of the privileges of my career. But it was always difficult because we got so much funding from central government, but we were also lobbyists. We also really wanted to criticise the government around their HIV testing policy, their lack of investment, particularly in sexual health services, and yet they were funding us. And so my hope is that you don't, within Health Watch, so you've got to get funded, but how do you manage the kind of, yes, you know, you can fund us, but we're not going to become your spokes. We're not going to become your voice. We're going to maintain our independence, and that's really difficult when your funding is coming from a range of different sources. So my hope is stay courageous. Don't become the voice of the people who are funding you. Become the voice of the people who need you.
That's a brilliant takeaway. So, final 2 questions.
Why are you smiling? I'm worried now.
Now, the first one is one that we ask everybody. What would the title of your life story be?
Gosh. Regrets, I've had a few.
I like it. This may be the title of the podcast. And the final question is, what's your favourite Christmas song?
It's boring, but it's White Christmas. I mean, it's the classic, it's there. I thought you could ask my favourite Christmas film, which is obviously Love Actually, and the best film ever made, without doubt. Anybody who disagrees without listening to the podcast, really, I mean, they haven't watched it enough, in my view. So yeah, White Christmas, absolutely love it. The original Bing Crosby, you know, what a great film. I shall watch that at some point over the holiday period, along with a lot of other rom-coms, because that's a bit weird, but I can't actually believe I'm admitting to that to however many people might be listening to this podcast. But yeah, White Christmas, and regrets, I've had a few.
Excellent. Thank you, Nick. That has been a really enjoyable conversation, and I wish you well on your next adventure.
Thank you very much, and good luck to all of you in the work you do.
Thank you very much. Thank you everyone for listening. We want to hear from the public about their views on our future. We have a survey open on our website until the new year. Details are in the description.